Good morning po to our media partners and to all our viewers live via Facebook and YouTube, and welcome to the DOH COVID-19 Media Forum for September 24, 2021. To give us the latest updates on the COVID-19 situation, here is Undersecretary Maria Rosette Singh Vergere, our DOH official spokesperson. Magandang umaga po, Yusuf Rosette.
Good morning, Lindsay, at magandang umaga po sa inyong lahat. Welcome to our Friday's DOH Beat COVID-19 Media Forum. Before we start our question and answer portion, nais po namin pong muling ipaalala na bagamat nakakakita po tayo ng pagbagal sa pagdami ng COVID-19 cases, ay dapat manatili pa rin tayong maingat laban sa sakit. Sa ating mga local government units, patuloy po nating ipatupad ang prevent, detect, isolate, test, treat, and reintegrate strategies at aktibo po nating hanapin ang mga nagkakasakit sa ating pamayanan at paiksiin po natin ang pagitan ng detection to isolation. Magsasagawa din po ng mga granular lockdowns kung kinakailangan to cut the chains of transmission. Upang mapigilan naman po ang pagkakahawaan sa ating tahanan, pamayanan, or workplaces, dapat po lagi tayong susunod sa mga minimum public health standards. Dapat din po tayong umiwas sa 3 Cs o sa closed spaces, crowded spaces, and close contact settings na kung saan present po ang 3 Cs na ito at mataas ang tsansa ng pagkakaroon ng clustering of cases. Hinihikayat din po natin na magpabakuna kung kayo po ay kasama na sa priority population para mabigyan po ng dagdag na proteksyon ang ating sarili, ang mga taong mas vulnerable sa COVID-19, pati na rin po ang mga mahal natin sa buhay na hindi pa po pwedeng bakunahan. So let me first begin with a short update on our COVID-19 situation. On September 23, 17,411 new cases were recorded, bringing the total reported confirmed cases to 2,434,753, of which 6.81% are active cases, 91.65% are recoveries, and 1.54% are deaths. Looking more closely at our active cases, 97.88% of these are either asymptomatic, mild, or moderate. 2.12% or 3,514 are severe or critical cases. For September 23, the top 5 regions contributing to these new cases are NCR, Regions 4A, 3, 2, and 6. The top 5 areas contributing to these new cases are Quezon City, Cavite, Rizal, Bulacan, and Isabela. Looking at our epidemic curve, we see a new peak every week since the start of August. The average of cases in the previous week is twice as much the average of cases in the peak we saw last April. Cases from September 17 to 23 recorded 18,708 cases per day, a decrease of 8% or 1,662 cases from the previous week. Disaggregating our epidemic curve into major island groups and the NCR plus areas, we have noted for the following. While the National Capital Region and the plus areas, the dark blue and the green lines, showed the steepest increase, these areas show a sudden downward trend in the recent week. The rest of Luzon, the red line, however, continue to show an upward trend, even exceeding that of the National Capital Region. Visayas, the teal line, showed only a slight increase and is currently at a plateau, while Mindanao, the yellow line, showed a slow increase over the period of August is currently at plateau. Nationally, we remain to be at high-risk case classification with a positive 2-week growth rate at 4% and a high-risk average daily attack rate at 17.73 cases for every 100,000 individuals. A decrease in 2-week growth rate is seen nationally and in most 15 regions, but majority maintain positive growth rate and high-risk attack rates. We are flagging CAR, Regions 2, 1, Caraga, Region 6, 12, 9, 5, and 4B with high-risk case classification based on its moderate 2-week growth rate and a high-risk average daily attack rate. 6 regions show negative 2-week growth rate, including the National Capital Region, regions 4A and 3. The national total bed and ICU utilization rates are at high risk at 70 to 78% utilization. 9 other regions are with high-risk beds and ICU utilization. These are CAR, Regions 2, 1, Caraga, Regions 12, 9, 5, 4A, and Region 3. 5 other regions are either with high-risk beds or ICU utilization, and these are Region 6, NCR, 11, 10, and BARM. NCR showed a negative or low risk 2-week growth rate and a high risk average daily attack rate and is currently at moderate risk case classification. The ADAR decreased to 36.59 per 100,000 population in the recent week. Its health system's capacity is at high risk and ICU utilization is at 77% and the total bed capacity approaching high risk at 68%. In the National Capital Region, the 7-day moving average shows a slight decrease as cases in the recent 7 days have decreased compared to the previous 7 days by 1,362 cases or 23%. First is the time varying reproduction number or the RT. The RT refers to how many additional people is infected by one case and the rate of infection or the growth of cases. The RT as of September 9 was 1.004. If the RT is more than 1, then a case is still infecting at least one other person. While there is no standard benchmark for how low an RT should be, a sustained RT less than 1 reflects a smaller number of additional individuals being infected. We also noted a continuous decline in RT since August 24 at 1.12 to 1.004 on September 9. A decline in RT means that while there are still more cases being reported, the rate of increase has slowed down. This was reflected in our 2-week growth rates reported, which showed that from our 2-week growth rates, while remaining at a positive rate, have declined. On September 19, we noted that while the 2-week growth rate was 32% 3 to 4 weeks ago, that declined to 18% in the recent 1 to 2 weeks. However, in assessing the COVID-19 situation, we should not look at just the growth rates, but also how large a population is affected. The latter is reflected by our average daily attack rate, which remains to be at high risk at 38.04 per 100,000 population, which is the highest among all of the regions in the country. The second would be, let us look at the projections made by the FASTER team with the STWG on data analytics as of September 19. From this projection, the peak in active cases was expected around the last week of September to the first week of October. As we often mention, these projections are not set in stone, primarily because these are also based in the assumptions and the changes in our actual case trend. We remain cautiously in interpreting our numbers. While we are seeing signs of decline in cases, it is important to keep in mind that our trend is also affected by factors such as our testing output and the detection activities such as active case finding and testing. Let us look at our RT-PCR laboratory output. Looking at our daily test and daily positivity rates, we saw that compared to the previous 7 days from September 8 to September 14, daily tests as of the recent 7 days were down by 5.3%, currently with a 7-day moving average of 77,033 tests. The national positivity rate for the recent 7 days was at 25.5%, down from 27.5%. A decline in the positivity rate mirrors the slowdown in the 2-week growth rate we have previously presented. However, in this slide, we have observed that 7 regions had less number of RT-PCR tests done in the recent week versus the previous week. The largest decline was for the National Capital Region, where from 287,548 tests done, it was lower by 29,501 or 10.3%. This translated to lower positive individuals from 66,654 to 50,194. We are currently assessing the reasons for this decline and if this reflects a true decline in cases or just affected by the other factors such as ongoing active case finding and contact tracing and the use of antigen to complement the RT-PCR testing. So our key messages for this week, we have observed over the past month that while reported cases remained high at the national level and at the national capital region, there was a slower rate of increase. This slowdown in new cases was reflected in the positive but lower 2-week growth rates over the past month and a similar decline in the RT. Our RT remains to be more than 1, signaling continuous infection of at least 1 additional per case, and we need to reduce and sustain this to less than 1. The large decline in reported cases have been largely affected by the rapid and large decline in the RT-PCR laboratory output. Thus, the need to interpret our case metrics carefully and the ongoing assessment of the Department of Health to determine what factors led to this much lower test output. Thank you, and over to you, Lindsay.
Thank you very much, Yusek. I will now be reading the questions sent to us by our media partners. So we have several questions regarding the waiving of the use of face shield outdoors from Caroline, Greg, and Kay. Yusek, kailan daw po magiging effective yung changes sa policy sa face shield use and kailan po maglalabas ng guidelines regarding this?
Yes, Lindsay, no? So Caroline and Greg, unang-una, ang policy nitong sa face shield was a joint memo circular issued by 8 agencies, including the Department of Health. So for us to be able to revise our guidelines or policy, it has to go through this revision of the joint memo circular. At yan po ang ginagawa natin ngayon. We already have prepared the revisions. Kailangan lang po magkaroon ng concurrence among the 8 agencies included into this joint memo circular. Meron na hong rekomendasyon, katulad naman ng naging desisyon ng ating presidente. Ito naman po ay galing sa rekomendasyon ng ating mga eksperto kasama po ang Department of Health. So we reiterate na ang face shields po ay magkakaroon tayo ng refocus sa paggamit sa mga high-risk areas under the 3Cs framework, yung closed, crowded, and yun pong meron pong probability of close contact. So ito po yung indoor activities, especially in settings where there is crowding or exposure risk or promotes close contact based on the nature of work, such as with establishments and in transportation. Second, nakalagay din po sa rekomendasyon, kailangan naka-face shield pa rin tayo indoor and outdoor dining, except of course when you are eating already. The third, indoor and outdoor gatherings or crowded settings. Next would be indoor and outdoor activities that promotes close contact, such as personal care services as applicable, and other activities not otherwise specified that follow the 3Cs framework. So it is highly recommended, nakalagay din, use in settings not otherwise stated, especially in alert levels 3, 4, and 5. So yun po yung kabuuan ng rekomendasyon ng ating mga experts together with DOH, and this is what we are drafting right now for this joint memo circular. But of course, this has to have the concurrence of the other agencies included into this joint memo circular. Lindsay?
Thank you, ma'am, from Caroline. Gaano po kalaki ang naibibigay na test ng Red Cross sa COVID-19? And nakausap na po ba kayo ng Pangulo tungkol sa sinasabing false positive results? Is this possible po? And are there official reports on this?
First, Caroline, no, ang Red Cross contributes about 20% of the total laboratory outputs for the whole country. Yun pong sinasabing paiimbestigahan, meron po kaming regular na process naman tungkol dyan. We have this regular quality assurance that our National Reference Laboratory ay ginagawa. Regularly yan, ano? So tinitignan natin para makita natin if there would be inaccuracies and that we can ensure na yung mga nilalabas nating mga resulta sa lahat ng laboratorio, hindi lang isang laboratorio, but all the laboratories are subjected dito sa quality assurance na to. For us to be able to do the process of quality assurance, kailangan may hinihingi tayong submissions from our laboratory so that we can complete the process, and our ITM, which is our National Reference Laboratory, makumpleto nila yung ginasagawang proseso for QA. So sa ngayon po, tayo po ay tumatanggap ng mga ganitong dokumento at saka mga specimens na hinihingi kapag nagkakaroon ng panel testing. So ito naman po ay regular na ginagawa natin, and we have not been amiss on this part of the process for quality assurance in our laboratory. So we do that, and this is being done regularly in all of the laboratories in the country that are licensed and accredited by DOH and our ITM.
Thank you, Yusek. From questions from Red Mendoza, Manila Mayor and Presidential candidate Isko Moreno said that yung budget daw po for the DOH coronavirus disease response ay inimbalsamo. What can you say about this, and what does the DOH think of using the so-called failed and botched COVID-19 response of the country and criticisms against the Secretary as a possible weapon or tool by the candidates in their campaign this 2022 elections?
Well, Red, tinutuloy naman yung mga investigasyon na sinasagawa ngayon. Meron na rin tayo mga sagot dun sa mga findings sa COA na ipadala sa Department of Health. So sa tingin ko, doon na lang yung proper venue para masagot lang yan, lahat yung mga akusasyon na yan. Pero gusto lang ho naming iparating sa lahat ng ating mga kababayan na kahit anuman pong mga accusations ang lumalabas sa ngayon, tuloy-tuloy pa rin po kaming nagtatrabaho at ibinibigay yung serbisyo na dapat para po sa ating mga kababayan.
Thank you po, Yusek. Can we have a reaction po from the DOH sa new study of Janssen that the second or booster dose of its vaccine will increase its efficacy to 94% 6 months after the first dose? Will the DOH consider these findings for a booster dose of the Janssen vaccine anytime soon?
Well, lagi naman ho nating sinasabi, no? So kung meron hong mga kompletong ebidensya na, pabor naman po ang Department of Health at ang national government para tayo po ay magpunta sa ganyang direksyon kung sakaling kailangan na ng boosters. Pero gusto lang ho natin magpaalala sa ating mga kababayan na lahat po ng ganitong klaseng ebidensya pinag-aaralang maigi. We have a process on how we do this. We have the vaccine experts panel together with the Food and Drug Administration that has to initially evaluate kung yung sinasabi ng trial nila ay talagang safe at saka will provide that efficacy, no, dun sa bibigay na protection sa ating mga kababayan. At pagkatapos niyan, it will still go through the process na ma-evaluate dun sa ibang factors na kino-consider natin kung sakaling tayo po ay magkakaroon ng mga ganitong third doses or second doses if J&J. At ito po ay tinitignan yung equity component, tinitignan din kung magiging cost-effective for the national government. So lahat po ito, ina-undergo natin yung process, but this, hindi niyan ibig sabihin na tayo ay hindi pabor. Kung meron na hong kumpletong ebidensya, lagi pong bukas ang tanggapan ng Kagawaran ng Kalusugan para sa mga ganitong evidences so that if it can protect or benefit our population better, and then we will go through that. But we need complete evidence for us to be able to recommend that so that it can be implemented.
Thank you, Yusek. From Bonds, may we know if test results using antigen are being included in the COVID-19 case bulletin? If yes, when did the DOH start including those?
Hanggang sa ngayon, pinag-aaralan natin, no, itong antigen test. Although katulad ng sabi ko sa inyo dati, hindi man na ipapasok ngayon dito sa ating completed case counts, no, dito sa official report ng cases, nakatali sa amin yan. We have the list. Nagkakaroon pa rin kami ng challenge dito sa mga submissions ng ating local government, especially those who are using the antigen test para gawin yung ating ginagawang response ngayon sa mga granular lockdowns. Nahihirapan din kami kasi aside from the local government units, marami na pong mga gumagamit ng antigen test sa mga maliliit na klinika, mga outpatient clinics, ginagamit na rin po sa mga bahay-bahay. So kami po ay naghihikayat sa ating mga kababayan kung sakaling gumagamit tayo ng antigen test, please make sure that you inform your local government, especially kung positibo po ang lumalabas sa mga resulta nyo. Dahil meron pa rin po tayong ibang proseso na kailangan isagawa at kailangan mabigyan din po kayo ng abiso kung ano ang kailangan nyong gawin once nagpa-positive po ang rapid antigen test na resulta nyo.
Thank you po, Yusek. Again, from Bonds, Halfway through the pilot run of the alert level systems over Metro Manila, are there talks to expand the pilot implementation to neighboring regions like 4A or parts of regions like the previous NCR Plus bubble? If yes, why?
Well, pinag-aaralan pa rin ng tuloy-tuloy bonds, no? Hindi naman natin pwedeng masabi na agad na we can already rule this out to other areas of the country. Isang linggo pa lang po natin na ipapatupad. Ngunit kahapon sa IATF, nakapagbigay naman ng progress report ang ating local governments at saka DILG kung ano po yung mga naging improvements dun sa kanilang response at ano pa yung mga kailangan nating ma-improve pa. Kaya nga po pilot because we are trying to test if this is going to be more effective para ma-curb natin ang transmission sa komunidad at saka ano pa yung mga pwede natin ma-improve dito sa unang linggo ng pagpapatupad. So we cannot say yet right now if we are going to expand, if we are going to add some more areas or are we going for a full national rollout already. Pag-aaralan po natin lahat yan hanggang sa makatapos muna tayo dito sa pilot implementation sa National Capital Region.
Thank you po, Yusek. From Lay Alvis, may we ask for a statement about the issue on test kits that exceeded their shelf life while in storage? Paano po ito nangyari?
Unang-una, hindi po kami bumibili ng test kits na wala na dun sa shelf life niya. We always procure test kits that are within the acceptable shelf life of that specific commodity. Pangalawa, kaya tayo ang mga test kits during the initial na nagpo-procure tayo during this pandemic, ang shelf life ng test kits is not the same as that of shelf life of medicines, yung mga drugs na binibili natin. Yung mga drugs na binibili natin, usually ang shelf life niyan 12 to 24 months, mahaba. Pero itong test kits na ito, maikli talaga yung kanyang shelf life. 6 months po talaga ang kanyang shelf life. Now, ito pong aming nabiling test kits na sinabi yung shelf life went beyond, ito po ay mga BGI test kits. Ang BGI test kits po, ginagamit ng maraming laboratorio din namin. Kailangan maintindihan natin, ang test kits, may klase ng test kits na appropriate lang para sa isang klaseng equipment. So if you have a BGI RT-PCR machine, your test kits, merong mga closed system at open system, maaring gumamit at hindi. Itong BGI test kits na nabili natin, meron siyang pwede siya, applicable siya sa automated o kaya sa manual extraction kits. So ang ating mga laboratorio during that time ng pandemya, nung initial months ng pandemic, they were using itong extraction kits na mga manual. Yun yung nauna nating nabili at may supplier. Kaya lang kalaunan nagkaroon ng automatic extraction kits. So instead of using the manual extraction, ang ginamit na ay itong mga automatic extraction kits. So that led to some of the kits na hindi nagamit, hindi masyadong nagamit because of these differences in the extraction kits that we can procure. Remember, during that time, there was this shortage. So kung ano yung mabibili namin, manual or automatic, binibili po ng gobyerno yan para lang makapagsagawa tayo ng tama na numero ng RT-PCR test din. So yun po yung sinasabi natin. So pero syempre, we have noted for these different issues, kaya po kami naglagay na po tayo ng mga safeguards from that time on. So ang atin pong supply chain and management team ng DOH po, nagkaroon na po tayo ngayon ng COVID-19 Supply Management Tracking System. Ito po ay isang sistema kung saan it's something digital, automated, na natatrack na po natin ang inventories natin ng COVID-19 supplies. Natatrack na rin po natin kung ano yung mga matatapos na yung shelf life. Natatrack na rin po natin what would be bound already for another procurement kasi kakaunti na yung inventories natin. Nag-impose din tayo nitong recall and replace mechanism dun sa mga purchase request natin. Specifically for these commodities na maikli po ang shelf life niya. So meron na ho tayo ngayong principle na recall and replace kung saan kailangan ang manufacturers pag dumadating na tayo dun sa maybe kung 6 months ang shelf life, nasa 5th month na, nagsabi na tayong hindi magagamit, pinapalitan po nila ng bago para na re-extend yung ating shelf life ng mga produkto na maiikli po ang shelf life. And that would be our safeguard so that we won't have this kind of issues again in the future. Lindsay?
Thank you, Yusek, for the clarification. Another question from Lay. Kung ang bakuna ay binili ng pribadong sektor para sa kanilang mga empleyado, gaya halimbawa po ng Pfizer at Moderna, maaari ba itong gamitin sa 12 to 17 years old dahil hindi naman gobyerno ang bumili?
Kailangan natin tandaan even private sector na nag-procure, they all went through this tripartite agreement with the national government. And isa po dun sa mga condition, dun sa tripartite agreement na yon, ay yung mga nagpo-procure po na from the private should abide and should align with the national government guidelines. At sa ngayon po, wala pa ho tayong rekomendasyon para mag-umpisa ng pagbabakuna sa mga kabataan. Kaya dapat po yung po mga private sector with tripartite agreements ay sumusunod po dun sa mga pamantayan at guidelines ng national government.
Thank you for Yusek. Some questions naman po regarding the implementation of the alert level system from Lay and Mark. May we ask for an update on the COVID-19 situation in NCR and gumagana na daw po ba ang new alert level system? 1 week after the implementation of the Alert Level 4, ano po ang assessment ng DOH? Maaari na rin po bang i-adopt ang Alert Level system sa iba nating lugar? If so, saan po target ipatupad at kailan?
Yes, Mark, no? So I've answered that already. Actually, for dito sa question nyo ni Lay, it's too early to say, no? Isang linggo pa lang po tayo nakakapagpatupad, hindi pa ho natin maibibigay at masasabi kung ito pong mabagal na pagbaba dito sa National Capital Region ng mga kaso ay talagang maiko-contribute natin solely dito sa pagpapatupad natin itong policy shift natin na ito. Isa po yan sa amin pong ginagawa ng analysis sa ngayon, but it is still too short a time for us to give appropriate recommendations if we can already rule this out to the rest of the country or pipili ba tayo uli ng ibang mga lugar na isasama. So kailangan pa ho namin na mas mahabang panahon, katulad nitong linggong parating, para makita ho natin yung naging epekto talaga nitong ginawa nating policy shift. But as we go along, we are seeing already that in the National Capital Region, katulad nung present ko sa slides kanina, meron na tayong nakikitang mabagal na pagbaba, no? So naging mabagal ang pagtaas ng mga kaso, naging mabagal, may mabagal tayong napipinto o nakikita na pagbaba ng kaso. Pero katulad din ng sinabi ko, ina-analyze po ng DOH kasi marami hong factors that might have contributed, no, dito po sa nakikita nating 2 araw o 3 araw na bumababa ang mga kaso. And one of the biggest factors might be the decrease in the laboratory outputs, no, here in the National Capital Region. So yan po ang ating pinagtatrabahuhan ngayon. We are coordinating with the MMDA, the local governments, to see kung bakit bumaba ang output. Ito ba ay dahilan ng rapid antigen test na paggamit o baka naman talagang wala na po silang case find. So kailangan ho naming malaman yan at pag-aaralan po at magbibigay tayo ng information to everybody.
Thank you, Yusek, for the clarification from Greg Gregorio. Yesterday's case bulletin was higher than the previous bulletin. Does this mean we're no longer in a decreasing trend?
Yan mismo, Greg, ang pinapaliwanag ko kanina, no? And I think this question will summarize, no, itong mga pinapaliwanag ko. Yun po yung gusto naming ipakita sa mga tao na hindi pa ho natin nakikita na consistent ang trend natin. Kung makikita nyo po, nung isang araw po ay bumaba na sa 15,000, no? 15,000. And then kahapon, 17,000. This kasi yung numero natin everyday are affected by a lot of factors. And one of the factors nga na sinasabi natin kanina would be the testing output ng ating mga local governments at mga laboratorio. Kaya po tayo po ay kailangan na maging cautious pa rin tayo. Ayaw pa rin ho namin magdeklara na sinasabing pababa na ang mga kaso. Kailangan pag-aralan muna po namin kasama ang ating mga eksperto if really this slow decline in the number of cases is we can confirm, no, na talagang bumababa na ang mga kaso o apektado lang kasi talaga ng testing output at iba pa hong mga factors na meron dito po sa parameters na mga ginagamit natin. So please, pinapakiusap ko po sa ating mga kababayan, tuloy-tuloy pa rin sana yung mga efforts natin. Ano? Kung sakaling totoo ngang pagbaba ito, maganda po yan para sa atin. Pero kailangan tuloy-tuloy pa rin ang pag-iingat. Ngayon, kung makita ho natin na apektado kasi nga po ito ng mga ibang factors, kailangan pa rin mapag-igting pa rin natin talaga ang pag-iingat. Whichever way, we still need to take care of ourselves, our families, and the community.
Thank you, Yusek. Another question from Greg. Is it true that new variants cause more virus in the air? Severe COVID-19 may trigger autoimmune conditions.
Greg, lahat yan, mga na lumalabas-labas sa mga maliliit na artikulo, pero katulad ng lagi nating sinasabi, babalik tayo, no? Ang mga desisyon at saka polisiya na pinapalabas ng Department of Health are all science-based and it's evidence-based. So kung may mga ganitong paunang artikulo na lumalabas, pinag-aaralan po mabuti yan. Kung po yan po talaga ay sukat at saka kumpleto yung ebidensya at talagang pwede nating ibigay na information sa ating mga kababayan. Sa ngayon po, mula po na nag-umpisang nagkaroon tayo ng mga variants of concern, wala pa naman po na nagko-confirm na talagang airborne yung transmission niyan. Kahit WHO, sinasabi pa rin, it's droplet transmission. Although in specific circumstances or settings, katulad ng closed settings, maaring magstay longer sa air ito pong mga virus. Kaya nga po, kailangan meron tayong adequate ventilation sa mga enclosed spaces. As to this severe COVID-19 na nagtitrigger ng autoimmune conditions, ito po ay patuloy na pinag-aaralan. Not just here in the Philippines, but all over the world. Yung mga iba't ibang komplikasyon na dinudulot ng COVID-19. But up until now, wala pa hong kumpletong ebidensya para sa lahat ng mga theories na ito o mga sinasabi nilang anecdotal na mga nangyayari sa pasyente. Pag-aaralan niyan lahat, Greg, at kung sakaling ma-confirm natin through evidence, and then we will be giving advice to the public.
Thank you, Yusek. Yusek, I will now be going through the questions sent to us through this Zoom chat box po. Again, a clarification po from Caroline. Given the recent data, can we say that the situation in NCR is improving or has improved a lot? And bakit daw po naapektuhan ng testing output ang overall case trends po natin?
Yes, Caroline, no? So, syempre, di ba, dun sa testing outputs natin nakukuha, yung number ng positive cases natin para i-report daily sa ating mga kababayan. So, kapag ka bumababa ang testing output mo, definitely bababa yung maire-report natin doon sa positive cases, doon sa ating case bulletin. Kailangan natin balikan, no? Bakit bumababa ang iyong pagtetest? Meron ka bang ginagamit na alternative kaya hindi mo na ginagamit ang RT-PCR? At alam natin lahat na especially here in NCR, pinayagan natin gamitin ang antigen test, especially in outbreak areas para dun sa appropriate use niya. So isa sa yan sa tinitignan natin na talagang kinakalap namin yung information about this use of antigen test, makuha natin ang report at makita natin meron ba talagang epekto, significant ba yung pagkawala ng RT-PCR versus the antigen test na dapat ang binibilang. So yan ay affected, no, yung ating numero ng kaso because sa output ng laboratories natin yan nakukuha. Yung sa NCR, katulad ng sabi ko, it is very early still now that to say na nag-i-improve na ang ating sitwasyon dito sa National Capital Region because of the policy shift. Kailangan ho pinag-aaralan maigi yan. We cannot just attribute to the policy shift itong nakikita nating pagbagal ng dami ng kaso, pagliit nitong 2-week growth rate natin. Hindi pa ho natin solely ma-attribute, kailangan pag-aralang maigi, and we should have that evidence to declare na yung policy shift ang nakapag-cause talaga nitong pagbagal ng mga kaso. Kailangan pa rin namin kumpirmahin na talagang bumabagal ba talaga ang kaso. So, kailangan ng pag-aralan maigi, and hopefully by next week we can complete our analysis already.
Thank you, Yusek. From Caroline and Greg, what led daw po to the recalibrated recommendation of the Department of Health and the experts with regard to the policy on face shields?
Ano yung question, Lindsay?
What led to the recalibration daw po of our recommendation on the use of face shields?
Yes, no? So we were doing a policy shift and we were able to study din naman yung mga factors, no? And we wanted to really focus on the 3 C's dahil nakita natin na especially with these variants, ito talaga yung pinakamataas na risk na mga settings na meron tayo, yung may 3 C's, yung crowded, may possibility of close contact, at saka close, no? So ito po yung pinagtuunan natin ng pansin at nakita natin that if we can be able to make it more rational and focused, na ito po yung mga specifics lang na gagamitan, mas magiging advantageous sa ating mga kababayan. Kasi talaga naman, kahit nung inilabas natin yung una nating polisiya sa face shield, meron po tayo talagang sinabing exempted kayo o kinukonsidera natin kung hindi kayo magkakaroon ng pagkakataon na isuot yan because of your work, because of your activity, or because of your specific condition. So kaya po namin na i-recommenda yun.
Thank you, Yusek. From Lay, what is the probable reason daw po kung bakit bumababa yung ating testing output?
Sabi ko nga, no, maraming mga factors na pwede nating i-attribute dyan sa pagbaba ng testing output. Unang-una na dyan, yung paggamit ng ating mga local governments with the rapid antigen test. Dahil pinayagan na nga po natin sila, mas mabilis po kasi ang resulta niyan at mas nakukuha agad at nakakapag-respond sila agad. So that's the major factor that we are looking at. The second factor would be that baka meron ding ang king logistical issues dun sa bawat local government. Tinitignan din po natin yan. Baka walang magsaswab o wala silang pang-swab o yun pong kanilang disease reporting units ay nagkaroon ng mga sakit yung mga tao, nabawasan ng workforce. So lahat po ng mga factors na to tinitignan natin para mas mabuo po natin ang analysis natin.
Thank you, Yusek. Yusek, clarification lang po from Sheila. Yusek Verheri mentioned earlier that 17 and 43 projected daily tally and NCR will not happen. May bago daw pong projections. Ano na po ang mga bagong projections? I think na explain na presentation kanina. But if you could reiterate lang po.
Nawala ka, Lindsay. Hindi ko nakuha yung mismong question. Yung ano yung question niya?
Yusek, from Sheila, Yusek Verheri mentioned earlier that the 17 and 43,000 projected daily tally in NCR will not happen. May bago daw pong projection. Ano na po ang mga bagong projections? Na napakita, I think, Yusek, if you could reiterate lang yung main points po ulit ng presentation niyo a while ago.
Yes, no. So Sheila, napakita natin kanina dun sa presentation. We will share with you the deck, no. Pero napakita natin yung ating projections, no, na bago ng faster, no. And nakakapagpakita tayo dito na sinasabi for active cases, we might reach about 58,000 by the end of September for active cases, and by the end of October we might have about 46,000. And then for daily cases, by the end of September, we might have 6,000 cases for NCR, and by the end of October, we might have about 4,450. We will share with you the deck. Kailangan lang maintindihan natin, I will just want to reiterate to all of you that these projections are not set in stone. That's one. Bakit siya not set in stone? Kasi linggo-linggo po nababago yung mga nakalagay po na assumptions natin dyan sa mga model na ginagamit na yan. These are projections. It doesn't mean that it is going to happen with 100% certainty. Katulad po dati, nakapagpakita tayo na 17 to 43,000 ang range na mangyayari. Pero ang assumptions natin na ginamit ay iba na sa assumptions na ginagamit natin ngayon. Kasi unang-una, yung cases natin, iba na from last week or 2 weeks ago. Yun pong vaccination coverage natin have improved a lot from 2 weeks ago. Yun pong ating compliance sa minimum public health standards at saka yung shortening ng duration from detection to isolation na nakita rin natin na umikli din yung panahon na yun dito sa National Capital Region. Kaya nababago po ang projections natin at masasabi natin na hindi po natin talaga sinasabing mangyayari yan. It will really depend on the assumptions that were included or the factors that may contribute if cases will increase or cases will decline. Lindsay?
Thank you po, Yusek. From Jomel, clarification lang po, wala pa po bang official recommendation ang DOH tungkol sa pagbabakuna sa bata edad 12 to 17 years old?
Jomel, kami po ay pabor, no? Kung sakasakaling makukumpleto yung ebidensya, kung sakasakaling may mga kasiguruhan na meron talagang bakuna para sa maitatabi na hindi natin madi-disenfranchise o mawawalan yung ibang vulnerable population sa ating bansa. Ngunit sa ngayon po, wala pa ho tayong naibibigay na sasabihin na we recommend the children to get vaccinated. Meron pa ho tayong inaantay na mga kondisyon na kailangang maisaayos muna bago po natin maumpisahan ang pagbabakuna sa ating mga kabataan. At ito po ay nai-relay na natin sa vaccine cluster po headed by Secretary Galvez and Yusek Mir na Kabutahe.
Thank you, Yusek. Question po from Kat Domingo. If you have the current data available na po now, kailan po nag-start yung digital and automated monitoring system for the pandemic supply as mentioned po a while ago, and how much did the DOH invest to put this system in place? If you have the answer right now.
Wala po yung datos ngayon, Kat, no? But we will get the specific details on this. But as far as I know, because these are measures or strategies for us to further improve our logistical supply and supply chain management system, ito po ay isang bagay na mga bagong ginagawa. Although we have our tracker before, ito po yung tinutulungan tayo ng USAID at saka ng iba pang development partners. But this one is specifically focused on COVID-19 logistical supply. So magbibigay tayo ng detalye sa Viber group, Kat.
Thank you po, Yusek. What does the DOH say na baka daw kung masyadong conservative yung ating figures na pinipresent despite the clear evidence that there is indeed a downward trend being observed as noted by different groups po?
It's not actually conservative, no? It's based on our numbers. Kaya lang, syempre, ang Department of Health, gusto ho namin, nagbibigay kami ng confidence or we are confident dun po sa nire-report namin sa public. Dahil hindi po kami pwedeng magsabi ngayon na, uy, bumababa na, ina-announce natin, magsaya na tayo lahat. Tapos bukas biglang tumaas yung kaso. Kaya kailangan po na-analyze namin na mas mahaba po. Hindi lang po kami gumagamit ng isang metric katulad ng RT. Marami po kaming tinitignan ng mga measurements, no, or parameters para po ma-determine namin ng maayos kung ano po yung talagang estado ng ating mga kaso sa ngayon. Katulad nga po ng pagpapaliwanag ko sa inyo kanina, hindi ho namin mabigyan ng confidence yung ilang araw na parang mukhang bumababa po ng mabagal ang mga kaso sa NCR dahil gusto muna naming tignan if it was affected talaga, if our cases were affected by our testing outputs dito po. Kasi nakita natin, dun sa pagbaba ng mga kaso, bumaba rin po yung testing output. Kung sakasakaling nakita natin na pababa na talaga, talagang mag-a-announce po ang Department of Health na talagang bumababa na. But we need to be very sure before we announce it to the public so that we won't misguide or mislead our public dito po sa mga datos na to kasi ito rin po yung binabasihan ng aksyon nating lahat, pati po ng ating mga implementers.
Thank you po, Yusek, for that very important clarification po, no? So, next question po, ma'am, from Leigh Alvis, another question po ulit with regard to the lowering down of the alert level system of NCR po. So, kailan daw po natin nakikita na pwede na i-recommend ang pagbaba ng alert levels sa NCR?
Itong alert levels na to, we analyze that regularly, no? So we have weekly analysis of these alert levels. And katulad nga ng sabi natin, meron po tayong parameters na ginagamit for that. And that would be the case utilization or case trends and also the healthcare utilization. So tinitignan po natin lahat yan. Pero kailangan maintindihan din po natin that as we go along with this pilot implementation, we are also studying the metrics that we are using. So tinitignan ho natin kung meron tayong pwedeng idagdag para mas maging sensitive ang pag-capture natin what's really happening on the ground. So alongside looking at the response ng mga local governments, tinitignan din po natin yung side kung paano natin sila mas ma-better ma-assess para ma-negate o matanggal yung mga biases na nakikita po natin dito po sa pagdedetermine ng alert levels. Let me just again reiterate to everybody, alert levels are not equivalent to our community quarantine classification. So the alert levels are being issued so that local governments and the community are aware of what they should do kapag nandyan kayo sa ganyang alert level. So yun pong pagka-transition ng National Capital Region into a different alert level, pinag-aaralan pa ho natin maigi, katulad ng sabi nga natin, we're looking at the different parameters, even their testing output. Kailangan ma-analyze po namin na maigi bago po tayo magkaroon uli ng rekomendasyon if they will have a lower alert level or they retain this alert level.
Thank you very much, Yusek. I guess that's the remaining questions that's left na po sa ating Zoom chat box. So before we officially end our media forum for today, do you have any other final messages po para sa ating media partners and of course to the public that's watching us right now?
Yeah, so maraming salamat po sa inyong lahat sa pakikinig. Maraming salamat po sa ating mga media partners. Alam po namin, katulong po namin kayo sa pagpapakalap ng mga tama na impormasyon sa ating mga kababayan. Bago po tayo magtapos, muli po namin pinapaalala sa lahat na tayo po ay magparehistro na at agad na magpabakuna kapag oras nyo na. So kailangan nyo hong dumaan kasi dun sa proseso ng ating local government that you should be able to register dun sa kanilang mga website para nakalista na po kayo dun sa schedule ng pagbabakuna. Para naman po dun sa mga nakatanggap na ng paunang dose or the first dose, siguraduhin nyo po na makukuha nyo o mababakunahan kayo nung pangalawang dose nang naaayon sa inyong schedule sa ating mga vaccination cards. Kailangan po tayo ay mabakunahan na, wag po natin, kahit po tayo ay bakunado na, wag po natin kakalimutan sumunod sa minimum public health standards upang patuloy po nating mapag-igting ang ating proteksyon para sa ating sarili and of course for your family and for the community. Nais din po namin magbigay ng paalala sa ating mga kababayan sa mga mahalagang bagay po na dapat nating panatilihin araw-araw. Panawagan po natin sa lahat-lahat ng ating kababayan sa publiko, yung pagmamask, yung pag-face shield, yung pong pag-physical distance, pag-iwas sa mga kulob at matataong lugar, ay nagsisilbing unang depensa po natin yan laban dito po sa mga sakit na COVID-19, hindi lang po sa COVID-19 na variant na meron tayo, yung kung kahit na anumang variant na maari pang dumating dito sa ating bansa. Atin pong isaisip na tayo ay may mahalagang responsibilidad sa kaligtasan at proteksyon ng bawat isa. Kaya araw-araw po, manatili po at panatilihin nating maging maingat at ligtas hanggat meron pa hong nitong pandemya at pagtaas ng kaso. So maraming salamat po sa inyong lahat and we will see all of you on Monday. Thank you. Thank you, Lindsay.
Thank you very much, Yusek. Maraming salamat po din sa ating media partners and of course sa public. Have a happy and safe weekend.